Another COVID-19 victim, brought to an already overcrowded crematorium in the city of Bengaluru. Soaring case rates spurred the city to impose a lockdown starting Monday morning. Police in some areas are beating lockdown violators and seizing their vehicles.
We will see that they are secured for longer time. If you see there is a very deliberate attempt to hoodwink the system and break the rule, then we will arrest the person also.
For now, Bengaluru's markets and stores are closed. There aren't many people here, but they don't maintain social distancing. After providing some relief to the poor, there's nothing wrong with a lockdown. Vaccinations are proceeding slowly in a country desperate for some way to bring infections under control. People are facing so many problems. They are sitting on a powder keg. They can easily get infected unless an alternative is found, like distributing the vaccines in more places, like community halls or playgrounds. There's no countrywide policy in place, and critics say the government has abdicated responsibility by leaving vaccinations to the individual states. That's resulted in a scramble. In Punjab province, people crowding a vaccination center put themselves and others at risk. We had to call the police to maintain social distancing, but to no avail. People are not listening to us at all, and we've been telling them continuously since morning to maintain distancing. Medical workers have mounted protests against the government's handling of the coronavirus, and the Indian Medical Association has called on the government to impose what it calls a complete, well-planned lockdown across the country. For weeks now, states have been competing for scarce resources, including oxygen. They've been left to the mercy of the market, leading to more anger and frustration with the government in Delhi.
Let's bring in our correspondent, Nimisha Jaiswal in Delhi. Nimisha, given the dire circumstances with the pandemic in India, why is the government hesitating to impose a nationwide lockdown?
Well, Terry, while there is no nationwide lockdown, most of the country is living under restrictions. Almost all the major cities are seeing a total lockdown, and many other districts are also seeing either a full or a partial lockdown. So this hesitation to impose a national lockdown is being criticized still because the need to break the chain of transmission is still prevalent. Now, rural India is facing the scourge of the coronavirus, suffering even more so because many cases can't even be diagnosed, let alone treated, because of a lack of healthcare infrastructure, and both vaccines as well as following of restrictions in these areas is limited right now, which is why there are such calls. However, last year's national lockdown was extremely unpopular, and there is analysis that perhaps the hesitation of the Narendra Modi government to impose another one rests on this fact.
It's a monumental challenge trying to vaccinate the hundreds of millions of Indians who are still needing vaccination. Is the vaccination program beginning to gather pace?
Unfortunately, Terry, quite the opposite. India's seen a serious dip in vaccinations at the highest levels. It had crossed over 4 million doses a day, but right now in this month, it has averaged below 2 million doses. And this, when this month has actually seen the expansion of the vaccination drive to everybody above the age of 18. Now, there are multiple reasons around this. The scarcity of vaccines is, of course, a predominant one. The states have now been handed the responsibility to carry out at least half of these vaccinations by procuring doses from the manufacturers directly. But another major factor could be vaccine hesitancy. Many in rural India are looking at rumors saying that they could get ill after receiving the vaccine and are hesitating in getting it.
The World Health Organization classifies the new virus variant found in India as a global concern now. Can you tell us, I know you're not an epidemiologist, but can you tell us what makes this variant so dangerous?
Well, the WHO has said, Terry, that this variant is more transmissible, and this is one of the criteria that makes a variant of concern. Some of the others are still being researched and processed for this variant, which is, does it evade antibodies? Does it not have as neutralizing an impact? Or does it evade vaccine? Now, all of this will, of course, increase concerns around this vaccine. There is a belief that the current surge in India could have been fueled by this variant. While scientists right now say that the vaccine is effective, there is also expert opinion that the vaccine design may have to be modified if it is found that these variants that the vaccines do not work as well against such variants.
Nimisha, thank you. That was DW's Nimisha Jaiswal in Delhi. Here's some other developments in the pandemic worldwide. China plans to draw a separation line atop Mount Everest to prevent the coronavirus being spread by climbers ascending Nepal's side of the mountain. The U.S. has authorized the Pfizer-BioNTech COVID-19 vaccine for children aged 12 to 15 amid a push to inoculate more Americans. And Germany has reported over 6,000 new confirmed coronavirus cases on Tuesday. That's 1,400 less than the previous week.